Coming up, we'll be on location at Artius Integrative Medicine in Tysons Corner, Virginia, discussing the benefits of integrative and functional medicine and how it can help effectively treat pain and other health issues and improve your overall health and wellness with one of this area's top doctors, Dr. Mary Babcock. Welcome, Dr. Babcock, to the Top Doctors Interviews program.
Thank you. Glad to be here.
All right, it's a pleasure to have you on today. You have this wonderful practice here in Tysons, Virginia. You've established a reputation for excellence in helping people improve their health, their wellness, and also in patient care. And I wanted to ask you, Dr. Babcock, if you could please begin by telling us a little bit about your vision for the practice and what you feel separates you from other doctors and practices in the region.
Well, I started out my career in the military and here in the DC area, and we were seeing a lot of the really complicated mystery cases, and so that actually started me thinking along the lines of integrative medicine. So I had an opportunity to start getting into acupuncture along with my medical practice, and when I got out of the military, went ahead and pursued to do more integrative medicine. And really what I found is, regular medicine, as we know it, standard medicine has a lot to offer, but there's certain things that it just doesn't address. And it's been a great opportunity since 2003, really to mesh the two together. So there's a role for everything, but you really can't deal with chronic issues or just optimizing your health without addressing the whole person and what other venues or different modalities that are available. So the vision for this practice is we combine both. We do regular lab work and see what we can do to optimize hormones, nutrition, nutrients, address the mind-body aspect as well with different types of therapies. And we also do acupuncture and massage as well as osteopathic manipulation here. And also vitamin infusions. So it's been a really nice treat to integrate it all. We are one of the few practices, integrative medicine practices in the country that actually accepts all insurances. So we're in network with pretty much everyone except for Kaiser and Medicaid.
That's wonderful. So you're really combining the best of all worlds of medicine, the conventional, traditional, primary care type of medical treatments and examinations combined with the integrative side of it, which really gets to the root of the problem. You're really healing people rather than just treating the symptoms.
Yes, and it's been very fulfilling to see people, one, just thrive, because our vision is really to help people not just survive but thrive, and then you really live, right? You want to be well, feel alive, so you can thrive in living. And so instead of just helping people not die, it's like, let's see what we can do to just optimize your health. And with that, when you feel better, it just pours into all other aspects of your life. And it's been really rewarding to see that. We do see some very mystery illness conditions, and it's been rewarding to find the root of the problem and really do a multimodal, comprehensive treatment plan to get them on the right path in their healing journey.
What I really love about your approach is that you understand that every patient is unique and every patient is different. Unfortunately, a lot of practices out there, they just get people in, get them out, and they utilize a cookie cutter type of approach. And you really analyze and get to the heart of the problem so you can really find out the root cause. And that's the benefit of integrative medicine. Now, I wanted to get to really help our viewers understand what is the difference between integrative medicine and conventional medicine.
Well, conventional medicine, and that's what I studied in school, so I can, from firsthand experience, you really just go through just the protocols and how to diagnose. So a lot of diagnosing, and but the approach is really pharmaceuticals and lifestyle change, a little bit of that, but really a lot of pharmaceuticals without addressing anything outside of that. We know nutrition's important. They teach us that in medical school, but they don't teach us about vitamins. They don't teach us about the details, or we don't delve into that because, there's so much to learn. And so they can only pack so much in medical school and then so much in residency. So I'm just thankful. I've always wanted to learn, and I've learned never to say never. So when I graduated from medical school and started doing integrative approaches, one of my friends told me, oh, well, you can probably learn acupuncture and incorporate that. And this was back in 2000-ish. I'm like, are you kidding me? I have no bandwidth to even learn that right now. Here I am, medical acupuncture certified, you know? And so it's just a constant journey because there are so many things being developed, more research being done. And so it's just nice to stay on top of the cutting edge as much as possible. And there's a lot of really exciting things and advances being made.
Yes, and you're helping so many folks in the community. We spoke with some of your patients, and they're just ecstatic. You've really changed their lives. You've helped them feel so much better with their health and wellness. And they talk about your patient care as well. You really take the time with each patient, and that's very important. And unfortunately, you don't get a lot of that in these days with most medical practices. So I love that old school approach of just sitting down with the patient, understanding their lifestyle, their lives, their health, because you know that all those aspects are all intertwined together. And you can't truly treat people to help them heal unless you understand all that.
Yeah, and listening is something that I think as a society we don't really develop as much, and we're all just thinking really fast. And there was one of my teachers in medical school, really old school guy, and he would tell us, you know, you can probably get the diagnosis if you listen carefully to the patient's history of their whole medical history and the symptoms of how they came to the problem. And so just really taking the time to get into the background really kind of helps put me in the right path and getting to the root cause.
Dr. Babcock, could you please describe the patient process from when a patient would first contact you? What can they expect?
Well, they can always call the clinic and book an appointment that way. For patients' convenience, we do have a new patient tab on our website. And you just to complete the form with the basic, you know, insurance information, why you want to be seen, and your demographics. And then we try to contact you within 24 to 48 hours to book you an appointment. Once you have your appointment, sometimes it might be just a telemedicine consult, which is covered by insurance, and really just to get the whole history. And it's a 30 to 45 minute appointment to do all that. And then I would usually schedule you for comprehensive lab work. Most can run through your insurance. And we also do some cardiac wellness testing, because I found delving into that is important in preventing a lot of issues, especially if you have a family history of high cholesterol, high blood pressure. Those are good reasons to get the cardiac wellness testing done. It's non-invasive. It does check your heart rate variability as well as your autonomic system to see if that's off. And you know, stress can cause that to be off, chronic stress. So these are different things we can utilize to fine-tune a treatment plan specific for the patient.
And what would you say are some of the key patient benefits from your thorough approach of really understanding the patient?
The main benefit is a patient gets to know their bodies and themselves a lot better through getting all this testing done. And it's nothing esoteric. It doesn't cost thousands of dollars. These are things that are normally covered by insurance. And it's just comprehensive. And so knowing that, it's just a matter of optimizing. Some of my patients with chronic issues, they come already with a stack of medical records, which I go through. And that's helpful, makes my job easier. But yeah, I guess the main benefit is just to take a step back and see themselves as a whole person, and down to their nutrition, down to their blood counts, and down to their hormone levels. Knowing that about your body can also help you with prevention. We have a number of patients who come to us and they just want to do their physical, a comprehensive physical, so they can avoid a lot of issues that run in the family. Or just in general, one patient's like, I have a stressful job, I have a stressful home life, and I'm healthy now, I exercise all the time, but I just want to make sure I stay that way. And we can help people like that. And then we have other patients we can help who, I've been to every doctor, every specialist, they still don't know what's going on with me. They offered me these treatments, but I'm not sure if that will really help. Can you help me? And so we can help people get to know themselves that way too. And a lot of times, you know, I love it when they come in with stuff that they've already done, because that just adds to the picture.
Well, that's a really wonderful approach because there are many people out there that are just prescribed medications and don't really know if their illness is being treated, or is it just the symptoms that are being treated, and then they end up living with that illness or chronic condition for the rest of their lives. But coming to a doctor like yourself, an integrative doctor with a comprehensive approach, can really help a patient heal the issue, get to the root cause, delve down deep to really understand what the problem is, and then treat it effectively.
Yeah, it's been a blessing. If I can make one comment, I guess one of the reasons that even helped me go into this is my mother actually had chronic pain. She was a workaholic, loved her career, and had to have heart surgery. It was her third heart surgery because she was born with a heart defect. Ever since then, it's not the fault of the surgeon or anything like that, but she then had left-sided pain, just left-sided nerve pain that was so severe she couldn't work anymore. And people tried to give her opioids. She's like, nope, not having any of that. And so she just did the best she could. Years later, when I was now a physician practicing, and she was hospitalized for potential stroke symptoms and worsening heart failure, the physician who was taking care of her was open to, doing some testing. And she had been to so many academic clinics and so many places to figure out what was wrong with her. It turns out no one actually did a head CT because it just got missed. They thought it was all heart. They thought she was just, they weren't listening. She had a thalamic stroke, an old one, and we just got her on a low dose of a nerve medication, pain-free. She only had to take it every night, and she's like, why couldn't you finish medical school earlier?
That's great. So it
Yeah.
really hits home with you because it's a personal experience that you went through with your own mother.
Yeah, so I was still a child, but I remember her being so frustrated with not getting listened to. People thought trying to send her to a psychiatrist or a psychotherapist, and she's like, it's not anxiety. There's something wrong.
Right.
And granted, there's nothing wrong with psychotherapy. In fact, our approach is mind-body medicine. When you have something chronic or something very severe impact you, it does mess with your mind a bit, so you can't ignore that. But it's not the first go-to. We have to get to the root of the problem first.
What are some of the most common or typical type of health issues that you address?
Well, let's see. Other than the folks who just want prevention and just want to optimize their health, we do a lot of hormone optimization. But people with chronic fatigue, chronic brain fog, or something like, ever since I became menopausal, it's hard for me to lose weight. I have problems sleeping. I feel more anxious, things like that. I also see some chronic Lyme patients and chronic anything, really. Somehow, because I myself have hypermobility, so I see a lot of Ehlers-Danlos patients, which is a genetic condition dealing with hypermobile joints, but it also affects the whole body and all the organ systems. So the best approach is treating them holistically because it affects everything when you have that condition. So anyone who wants more answers and are willing to get better. So.
Well, we don't have enough doctors out there listening to the patients. They actually talk to the patients and don't speak with the patients, so they don't really converse as much. And I think getting to the root of the problem takes a lot of listening so you can understand what's going on in that patient's life.
It does, and we do try our best to partner with them because the comprehensive treatment plan can be a little overbearing. How do you eat an elephant one bite at a time? And we just got to peel that parfait, I guess, from Shrek, I don't want to be an onion, just call me a parfait. But just to get just take it one step at a time, and we try to be available as best we can. We've hired more staff to be able to communicate. We fixed our portal so patients can ask us questions when the clinic is closed and get their answers within a reasonable time frame. So all the regular things that medical practice has to overcome, but we're constantly trying to get better at that.
What would you say the types of results are that your patients are seeing from a lot of these treatments?
That's why I do this. It's so rewarding. When you have someone who has severe post-traumatic stress disorder, who just flinches at the opening of a door or things like that, to being able to not have any pain, not have spasms, not have seizures, and be able to get into photography or just live their life. That's one case. I have another case, someone with severe anxiety, and turns out it was a mold toxicity condition. Anxiety and depression and brain fog, turns out it's a hormone imbalance condition. So it's really rewarding to just see people feel better and just be happier. So it's when I get them where they just come for their physical as opposed to coming every month, it's like that's what I do it, you know.
Well, that's great to hear, and keep up the great work. You and your practice here at Tysons, as I mentioned, RDS Integrative Medicine is doing great work, helping so many patients. And on that note, I want to thank you, Dr. Babcock, for joining us and being a guest today on the Top Doctors Interviews.
Thank you, my pleasure.
I was diagnosed with a rare condition called Ehlers-Danlos syndrome, and also with that comes two other conditions called mast cell activation syndrome and hyperhidronic POTS. They're very rare, so they're very hard to treat. And also there's no cure, so they are hard to manage. So I came to Dr. Babcock in order to kind of seek that health management and have someone to kind of partner with me in order to figure out how to handle the myriad of symptoms that I was experiencing because of these conditions. So today I had a Myers cocktail done with oxygen, and when I get that done, I can definitely notice a difference in my overall I guess longevity, if you will. I have to stay very physical because of my health conditions, and I have to stay very active. I do a lot of physical therapy, I do a lot of yoga, I work out all the time. And so this IV really helps give me that longevity, and also I can definitely feel the oxygen after I have the IV if I go running or do something else that's very cardiovascular. I feel great about the results. I actually just found out today that apparently it's supposed to be anti-aging too, so that's great. But what I've noticed is that I can I've had to beat Lyme in the last year. I've had to beat Epstein-Barr virus in the last year. And I noticed after every infusion, I felt better. I also felt more clear-headed. And then also, I was able to, just get that hydration that I really desperately need because of my hyperhidronic POTS. It's given me a lot of hope, to be honest with you. There's not a lot of doctors, especially with rare conditions, that will give you the time of day. So having somebody that actually tells you what to do with a good IV that's actually helping you, it's a game changer, and I feel like I've gotten my quality of life back. My overall experience with Dr. Babcock and RDS as a practice has been wonderful. I've been seeing them for, I guess, about 3 or 4 years now. And initially, Dr. Babcock was a doctor who gave me a voice to actually get me the diagnosis I'd been looking for after 10 years, and then refer me to the specialist that I needed to see in order to confirm this diagnosis, and run the myriad of tests in order to confirm this diagnosis. After I was able to get those answers, which again, I was looking for those for 10 years and really honestly, truly suffering, I've gotten my quality of life back to a whole nother level. It's not like Dr. Babcock just diagnosed me and walked away. She diagnosed me, sent me to a specialist to get, all the testing done, and then she's been kind of my partner in trying to manage my health issues and my myriad of doctors over the last 3 to 4 years. And I'm happy to report I wasn't able to work full time. I'm an engineer. And I am back working right now this year. And so just from the time that I have seen her, she's drastically changed my life. And as far as the practice goes, everyone's really, really nice. Everyone's very welcoming and professional and respectful, and really does give you the same generosity and respect and care that Dr. Babcock does. I would highly recommend coming to see Dr. Babcock and her team in order to make you feel your best way possible. And if someone like me who has a bunch of different things going on can say I feel the healthiest I've ever felt in a long time, I think you will find very, very similar and rewarding results.
In 2018, I heard about RDS and came here. One reason is for back pain, general back pain and shoulder pain. For the back pain, the doctor does both osteopathic manipulation and injections. Now the injections are typical cortisone shots, but they're followed up with ozone treatments, and it's made a big difference. I can tell you that in my shoulders, for example, I had 2 torn rotator cuffs, and I've gone to several pain centers. I've had chiropractic manipulation, I've had physical therapy, and just mild relief or temporary relief. What the doctor did, Dr. Babcock, in this particular case, is injected my right shoulder with cortisone, and it made a phenomenal difference. I told her about this recently. Just, I could move my shoulder, I could do things with my shoulder and my arms that I couldn't do before. She takes time to listen to you, and that's the important thing. She listens, you explain the problems, and she does a very, very good diagnosis. I'm very impressed in that she takes the time where other doctors don't take the time. I strongly recommend her, not only to my friends, to my family members that are in the area, but I've spoken to several people and have made recommendations for Dr. Babcock and the way she treats her patients and the results. That's the important thing, is that you get good results.
After years of being in chronic pain, muscular pain, and other less obvious illnesses, I became really disheartened with the way medicine is practiced. So if my shoulder hurt, I would see a back doctor, but if other parts of my body hurt, I would end up with another specialist. And so eventually what brought me to her was to manage pain and chronic pain on my muscles. She was highly recommended, and so I came to see her for trigger point injections, and definitely she was the best. The trigger point injections were administered every week, and they gave me a lot of relief. Eventually, I ended up seeing her for other areas of my health. I really liked the fact that she is a doctor of osteopathy and understood my body as a system, not just pieces, interconnected. And so I was diagnosed years later with an autoimmune disease, and also tested positive for Lyme disease. And I really appreciated the fact that she had alternative ways to helping me get to a place where inflammation levels were reduced in a natural way, not using drugs that otherwise would have hurt other parts of my body. And so since then, I basically have become, and this is 2019, give or take, I've become her patient. She is my MD, and I find that nothing I share with her, it's considered medical gaslighting, which other doctors may just not even want to talk about it. And so her willingness to work with me, it's something that I'm very appreciative of. So my overall experience has been one that is difficult to quantify. I became aware of the fact that I wasn't going to get the healing and the care I needed by seeing several specialists in different places, and obviously we don't have that time in life. I knew intuitively I needed someone that could put all the dots together. With Dr. Babcock, I find that she has that 360 that is very much, it's perfect for me. I can seek healing from a pain perspective. I can also cleanse my body, and she has all the different services that I personally have used, such as NAD and other therapies that frankly other places do not offer. And more importantly, she listens, and she's always willing to explore with me. I can't recall any time that I haven't brought to her something that I wanted to share or to continue to explore, and she is very compassionate, she listens, and she will take the time to explore that path with me. I'm not a number, I'm a patient, someone that she sees and cares for. So if anyone is looking for a place that or a doctor that will put together all the parts of our body in a way that is healing, compassionate, and definitely effective, I believe that Dr. Babcock is a person that will never let anyone down.